Before we can fully open up this economy, we have to have more testing. Everybody is saying that. All the experts are saying that. And not just testing for who has or who doesn't have COVID-19, but who may have antibodies. We've heard a lot about antibody testing. So Dr. Ben Springgate is with us this morning to explain exactly what antibody testing is. Ben, what is it exactly?
Well, an antibody is part of our immune response that is able to attack the virus and hopefully disable the virus. And antibody testing looks to see if you've previously been exposed to the virus. Maybe you had an infection with symptoms, maybe you had an infection with no symptoms. And ideally, it would tell us, did you have the exposure and might you have some subsequent immunity? Unfortunately, some of the tests aren't all what they're alleging to be, however.
And right now, there are so many people who are doing these antibody tests, but only a few are actually, sanctioned or okayed by the FDA.
That's right. The Food and Drug Administration, FDA, did provide emergency approval to a small number of tests within the last couple of weeks. And some of these tests have reasonable outcomes and the ability to test whether or not you really were exposed, but some of the tests are really kind of questionable and are not that great.
And there's so much we do and do not know about this antibody testing. If it actually is going to tell you that you are not going to get it again or whatever, we just don't know yet.
That's right. Part of the problem with the science of antibody testing right now for COVID-19 is that we don't know the extent to which having antibodies can help you stay immune to a reinfection or an infection in the future from COVID-19. We don't know what level of antibodies are necessary to protect you, and we don't know how long these antibodies last and offer any protection. So without that information, getting a test that may be correct or may be incorrect in saying that you have antibodies doesn't really help very much. In fact, it may encourage people to go out and participate in risky behaviors thinking that they are immune when in fact they are not immune.
And that's the fear by Dr. Fauci and Dr. Birx with the White House COVID-19 task force, is that too many people are starting to get a false sense of security that it's kind of over or it's waning down or it's safe to go out. And that's why you see states opening up now.
Right. It is important, as we reopen slowly, cautiously, carefully, continuing to look at the data to recognize that the risks are still out there. This virus hasn't gone anywhere yet. So we need to pay attention to the opportunities to continue to protect ourselves, even as we reopen our economy, reopen society.
And you were mentioning that before we came on, that you had driven around town and you see a bunch of places that say with signs that say COVID-19 antibody testing here, yada, yada.
Right.
How do you know if you're getting one that's accurate or FDA approved?
Well, you need to ask that question, first of all. Make sure that you're asking anyone who's offering you that test, has this one been FDA approved? Ask them, what is the sensitivity and specificity of that test, which are fancy words to know how accurate is this test? And before you go and pay for that test, make sure that you have gone back to double check to make sure that what they're giving you is correct information. Even with that information, however, we still don't know what levels of antibodies are needed to protect you from a future infection. So if you have a positive antibody test, if you're confident that the test is accurate, we still won't know whether or not you are protected and immune from getting another infection until further information is available in the scientific and medical community. This is not a pass that says you can go out and do whatever you want. This is simply a marker that you may have been exposed previously, and that's all it is at this point.
And quickly, last thing, we're seeing deaths continue to increase in this country. We're now above 70,000 across America. Are you concerned, like other doctors, that maybe we are moving a little too fast on reopening, and people should still hunker down?
It's clear that we do need to reopen, and slowly and carefully. But my concern, as with many others in the medical community, is that we do so in such a way that we're maximizing every opportunity to maintain social distancing in these workplaces and these business establishments. We continue to wear masks, and that we're not jumping back and assuming that things are quote unquote back to normal, because they're not going to be back to normal for some period of time. We can move forward with reopening. We just have to do it cautiously, carefully, using the data and information that's available to us, and to take care of ourselves and one another.